Here is a detailed explanation of the Total Thyroxine T4 test. Inch 1, Introduction. The Total Thyroxine T4 test is a blood test used to measure the total amount of the hormone thyroxine in your bloodstream. Thyroxine is one of two major hormones produced by the thyroid gland. The other is triiodothyronine, or T3. Thyroxine plays a vital role in metabolism regulation, growth, and development. This test helps in evaluating thyroid gland function and diagnosing thyroid disorders. 2. Definition. The Total T4 test measures both free and protein-bound thyroxine in the blood. Free T4, the biologically active form. Bound T4, T4 attached to proteins, primarily thyroxine-binding globulin or TBG, making it inactive. Total T4 of free T4 plus bound T4. This test gives an overall picture of the thyroid hormone level in the blood. 3 indications. The Total T4 test is indicated when a patient shows signs or symptoms of hypothyroidism or hyperthyroidism, screening for congenital hypothyroidism in newborns, monitoring the effectiveness of thyroid hormone replacement therapy, diagnosing pituitary gland disorders affecting thyroid-stimulating hormone, TSH, evaluating goiter, irregular menstrual cycles, infertility, or cardiac arrhythmias. Used for diagnostic purposes for thyroid dysfunction, to assess metabolic activity in individuals with unexplained weight gain loss. Monitoring patients on thyroid medication, evaluating thyroid hormone production in people with known or suspected thyroid disease, part of prenatal screening in pregnant women. 5. Why do need of this test? You may need a T4 test if you experience symptoms of hypothyroidism, fatigue, weight gain, dry skin, constipation, cold intolerance, symptoms of hyperthyroidism, weight loss, heat intolerance, anxiety, tremors, palpitations, to detect abnormal thyroid function early, even before symptoms occur, to monitor response to treatment in patients taking thyroid hormone therapy. 6. What happens during the test? A healthcare professional will clean the skin and insert a needle into a vein, usually in the arm. A blood sample is drawn into a test tube or vial. The process takes 5 to 10 minutes and causes minimal discomfort. The sample is then sent to a laboratory for analysis. 7. How long for my results? Turnaround time is usually 24 to 72 hours, depending on the lab. In urgent cases, e.g. hospitalized patients, it may be available within hours. 8. Preparation for this test. Generally, no fasting is required. Inform your doctor about all medications, supplements, or hormone therapies you're using. Some medications that may affect the results include oral contraceptives, corticosteroids, thyroid hormone replacement, levothyroxine, anti-seizure medications. 9. Risks. Minimal risks as it's a simple blood test. Possible side effects at the puncture site: bruising, slight bleeding, dizziness or fainting. Rare. Infection. Very rare. 10. Normal values. 4.5 to 11.2 micrograms per deciliter. Quaintner. Children and newborns may have slightly higher levels. Reference ranges may vary slightly between different laboratories. 11. Interpretation of results. Elevated T4 levels may indicate Graves' disease, thyroiditis, inflammation of the thyroid, toxic multinodular goiter, pregnancy due to increased TBG, liver disease, certain medications, e.g. estrogens, birth control pills. Low T4 levels may indicate hypothyroidism, Hashimoto's thyroiditis, severe illness or malnutrition, pituitary gland dysfunction, use of certain medications, e.g. phenytoin carbamazepine. 12. Factors affecting results. Medications, birth control pills, steroids, and anticonvulsants. Pregnancy increases TBG, leading to higher total T4. Liver disease alters protein binding. Acute illness or stress may transiently affect levels. Age. Newborns have naturally higher T4 levels. 13. Clinical significance. Abnormal T4 levels are central to the diagnosis and monitoring of thyroid disease. Essential in managing endocrine and metabolic disorders. Used to adjust doses of thyroid medications in patients undergoing hormone replacement. High T4 without symptoms may suggest subclinical hyperthyroidism. Low T4 with normal TSH may point to non-thyroidal illness, euthyroid 6 syndrome. 14. Know more. Complementary tests, often combined with TSH, free T4, T3, and thyroid antibodies for comprehensive evaluation. Free T4 test is more specific, but Total T4 provides overall hormone availability. Total T4 may be misleading in conditions that affect TBG levels, e.g., pregnancy, liver disease. 15. Conclusion. The Total T4 test is a valuable diagnostic tool to evaluate thyroid function and detect abnormalities in hormone levels. While it measures both active and inactive forms of thyroxine, it's often used alongside other thyroid function tests to provide a complete picture. Understanding your T4 level helps in diagnosing thyroid disorders early, guiding appropriate treatment, and maintaining overall hormonal balance. Thank you. Have a nice day.